Hello, everybody. Good afternoon, and welcome to today's expert panel on the intersectional developments in cardiovascular health and policy. My name is Alina, and I'm going to be the moderator for this event. Now, before we get started, I'd just like to briefly introduce myself and the organization that is hosting this event. I'm here today representing Guardians of the Heart, a student-led nonprofit whose mission is to empower young people with the knowledge, tools, and resources to take control of their heart health from an early age. Thank you to all of the students who help with this organization, namely Leia, Audrey, Lillian, Emma, and Karuko. And today's panel is part of a series of initiatives we're hosting to spotlight the latest trends, practices, and policies in cardiovascular health. And today's is with a special focus on legislation, advocacy, nonprofit work, and community projects. And today we are incredibly fortunate to have an outstanding group of experts with us who will be sharing their knowledge on this critical topic. And originally, Assembly Member Josh Jensen was going to join us as well, but unfortunately, he had a family emergency and was unable to come. In the future, hopefully, there will be another opportunity to invite him again. Now, let me take a moment to introduce our panelists here with us. First, Dr. Patrick Thomas is a board-certified cardiologist and assistant clinical professor of medicine at Columbia University, where he helps train future cardiologists. He previously served as chief of cardiology at New York Presbyterian Hudson Valley Hospital and chaired its medical executive committee. An active clinical researcher for over 2 decades, Dr. Thomas has focused on developing therapies to prevent and treat cardiovascular diseases. He has held leadership roles with the American Heart Association, including serving as president of its Westchester and Fairfield counties board of directors and previously as president of its Putnam County division. Second, it looks like Assembly Member Scott Gray just joined us as well, and he was elected to the New York State Assembly on November 8th, 2022. As a small business owner, he acknowledges the challenges of running a business in New York and will support policies that promote job creation and growth. Known for working across the aisle to get the job done, he served as chairman of the Jefferson County Board of Legislators for 6 years and as a legislator for 21 years in total. He is proud to have recently received the Secretary of the Army's Public Service Commendation Medal, which is awarded in recognition of service or achievements that contribute significantly to the accomplishment of an Army activity. Next, Brianna Durkee is an experienced lobbyist specializing in health policy and currently oversees state government relations for the American Heart Association in New York State. Leading efforts to influence legislation at the state and local levels, she collaborates with lawmakers, industry stakeholders, healthcare professionals, and advocates to advance initiatives focused on heart disease prevention, access to care, and community response efforts. Brianna is committed to promoting heart health and ensuring that legislative decisions prioritize all individuals being able to live longer, healthier lives. Next, Rachel Morris is Assemblywoman Amy Pollin's Health Committee Coordinator. Rachel graduated in 2022 from Rockefeller College of Public Affairs and Policy at the University at Albany with a Master of Public Administration degree and a focus on health policy. And this will be her 3rd year working at the Assembly. She has worked for Assemblywoman Pollin since the beginning of 2024, helping to work on bills such as the New York Health Act, as she is passionate about the importance of increasing access to healthcare to New Yorkers. And last but not least, in the 13 years that she has worked for Mended Hearts, Mandy Sankler has had the opportunity to serve and support volunteers, patients, and families affected by heart disease. In her role as the Director of Partnerships and Communications, Mandy works with the organization's partners and sponsors on funding opportunities, program design and deliverables, and advocacy initiatives. She oversees all Mended Hearts, Young Mended Hearts, and Mended Little Hearts chapters and groups, helping them to grow and function. So thank you all again for joining us today, panelists. I'll be guiding the discussion using some pre-prepared questions, but we will have time for your valuable insights on a very wide range of topics, and we will also end with a Q&A session. So everyone feel free to type in the Q&A box any questions you may have. All right, let's start with the big picture. How does your personal journey intersect with the initiatives, policies, and legislation that you have supported and advocated for to improve cardiovascular health? Dr. Thomas, would you like to start us off?
Absolutely. Thanks for having me be part of this incredible panel that you've assembled today. It's an honor to be here. My personal journey with cardiovascular disease started long before I became a cardiologist. In the early 1980s, when I was a teenager, my father had his first of what would become dozens of heart procedures when he was quite young. And I learned that cardiovascular disease was really rampant on both sides of my family. And as I went through my training and became a cardiologist, I learned the rather stunning statistic that over 80%, that's 80% of all cardiovascular disease, all heart attacks and strokes, it's preventable. Sure, sometimes people are born with heart defects or they have an esoteric disorder that leads to heart disease that can't be prevented. But the vast majority of conditions I've treated over the last almost 30 years have been easily preventable just through lifestyle modifications. And so I've been an advocate for prevention for decades. And we know that especially in young people under the age of 20, that the earlier you start with improvements in diet and exercise and avoidance of smoking and vaping, the better your chances are of escaping cardiovascular disease. And yes, it's important that everybody knows CPR, and defibrillators are placed in all public spaces, something that the American Heart Association has advocated for a long time. But it's much better to focus even more on the prevention so that you don't need to do CPR, that you don't need to have a defibrillator available. And so in my 20 years of volunteering for the American Heart Association, I've really supported a variety of policies that have led to significant improvements in cardiovascular health throughout this region and throughout the nation. Some of those policies have included the elimination of sugar-sweetened beverages from school cafeterias, improved nutritional education and heart-healthy diets in schools. We can talk a little more about that later. Legislation to improve access to healthy food for people who are economically disadvantaged, improved opportunities for youth and adults to exercise regularly. And finally, the strict regulation of and limitations on and potentially elimination of smoking and vaping. So that's really been the genesis of everything that I've done. It started with my dad when I was quite young, and it's really been a focus of my career for decades. And again, it's an honor to be here. Thanks for having me.
Thank you for sharing, Dr. Thomas. Assemblymember Gray, I'd love to hear your thoughts on this.
Thank you very much. Pleasure. And I appreciate you assembling this panel this afternoon. A couple of things. One, I will tell you the cardio health is very personal for me. So back in 2004, I had cardiomyopathy and I was in congestive heart failure at the time. I was in my 40s, I think, back then. So I was in congestive heart failure. So actually, it was in a political campaign and I was having problems breathing and sleeping, so eventually, I was initially diagnosed with uh, just an infection in my chest. So, and then I was later, within hours, I was rushed to St. Joe's in Syracuse, where I subsequently ended up having, I think it was, all in total, I had 6 ablations. I was uh, converted many different times. A lot of times I was converted. So I had went through St. Joe's in Syracuse. I was in Strong for quite a while, Memorial in Rochester, and eventually I went out to Cleveland Clinic, where they eventually did. And in Cleveland Clinic, they actually acknowledged that it would take 2 ablations, and I'd had, I think, 4 previous to that. One was aborted in Strong Memorial because they actually have to induce it, map it out, and we have a cardiologist here that probably knows all of this. So they have to induce it, they have to map it out, and then they couldn't convert me back. So it's obviously too dangerous to do an ablation once you're in AFib. So I was very symptomatic, and at the time, I think I was probably around 250 pounds. So, and I will never forget the doctor in Strong Memorial Hospital when he said to me, he asked me for all my medications, and I told him, I said, "You're gonna have to wait for my wife. She'll go through everything." And he actually dropped his clipboard and he gave me a lecture on the fact that with a change of lifestyles, just as the Dr. Thomas just described, with a change of lifestyles, your heart's a muscle and you'll be able to rebuild it and you'll be able to live a very healthy and happy life. And so subsequent when I was actually, I guess, fixed for good. I haven't had any problems since then. That's when I began a journey of physical fitness. Quit smoking, drink considerably, maybe just socially here and there, but it was all lifestyle changes, and now I live a very healthy and happy life. So having said that, on the policy side, now that's the personal side. So the policy side, my time in the community, I have served also on the hospital board. So I know, and plus my time at the county, I was chairman during the pandemic. So, which is why I got the recognition from the U.S. Army. But access. So access and education is everything that we need to be doing in order to make sure that people are living a very healthy lifestyle. And I think we have to do that in terms of policy measures. We have to make sure that, we're providing access. We're making sure that access is available in the hospitals and doctors' offices, and we also make sure our medical professions are being paid appropriately in the case of if they're having to get reimbursed by Medicaid or something like that. I think it's very important that we keep both sides of their ledger happy. And I have experience because I was on the hospital board. So I know very much the struggles of, served on Treasury. I was the treasurer for hospital board. So I very much know the struggles that healthcare communities go through. They go from very highs to very lows financially, and everything is a struggle. So I would say on the level right now of New York State, I consider our healthcare industry to be in a very critical state. And critical state of access. For people with lesser means, and critical state for providers and for enough providers out there, and just make sure that the whole system is working. Our system seems to be very, very, probably a polite way of putting it right now, is fragile. So yeah, so that's about it from my end. Thank you very much again. I appreciate it.
Yes, thank you for that. Let's move on to Brianna. What would you like to add about this?
Hi, Alina. Thank you for having me. I would say my personal journey kind of started off a little bit differently. I was very interested in policy. I became a lobbyist, and I did work to some degree on health policy and healthcare policy before coming to the American Heart Association. But one day, I had a very eye-opening experience. My little brother, I call him little, we're adults, but my younger brother at age 16 went into heart failure. And it was very unexpected. But it was a moment in life where I saw just how important heart health was. And it changed me forever. I almost like to think it led me to the American Heart Association. Even having a background in health policy, I was not very knowledgeable about being proactive in prevention and taking care of your heart health and making it a priority. And after coming to work for the American Heart Association, I feel like I had become, not only because of my job, but a huge advocate for living a healthy lifestyle and helping educate others around me, because I was educated to see how important, the heart is. And that being said, some policies that I've worked on in the past 3 years with the American Heart Association have been advocating for a tobacco-free lifestyle. So we have worked to increase the cigarette tax. We have also worked to get flavors for e-cigarettes off the market, as well as menthol cigarettes. And we worked very hard to expand postpartum Medicaid coverage to connect women, both pregnant and postpartum, to the care they deserve and need. We've also been working to connect individuals to healthy foods by expanding SNAP access and working on healthy school meals for all, again, instilling those healthy eating habits for individuals at a young age. So, and lots of more policies to come. Our work is never done on this, but all with the same goal.
Yeah, I definitely agree with that. And what about you, Rachel?
Hi, thanks for having me, of course. I remember always hearing about as a kid, family members of mine who had cardiovascular issues, people who had died before I was born, and it always felt like something on both sides of my family that my parents were like, you gotta watch out for your heart and high blood pressure and all these things I had always grown up hearing. I do jump rope for heart. My mom would always write down the family members I was jumping in honor of when I was a kid. And it was just something that was one of the issues that I just heard about a lot. It's also something that's close to Assemblywoman Paulin, my boss. Her father had a heart attack while she was in college. And while he survived, he continued to have complications, which affected his work, and he died 25 years later due to those complications. And I think it's something that affects so many people in the US and worldwide. And that, along with so many other medical things, got me interested in health policy and how prevention is something that can work to, mitigate a lot of these issues. And throughout my time at the Assembly and before, I've really learned about how improving healthcare, access to healthcare, and things like healthy diet, not smoking, and those types of things can improve health outcomes. And I think now seeing it from like the legislative side and how you can get things done, pass these bills that can work to improve people's lives through access to healthcare or giving kids healthy school lunches. And that's something that I'm proud to help work on and make an impact.
Yeah, that's great. And yeah, Mandy, I'd love to hear your thoughts on this as well.
Yeah, so, well, I do, my father did, suffer a heart attack and aortic dissection and an aortic aneurysm, and eventually did pass because of an aortic dissection, is what we believe happened. And while that definitely had an impact on me, what really has been just intertwined for the last 14 years now that I've been with the organization is that I've become friends with and just work with heart patients every single day. And I hear their stories every single day. They're volunteers who give up their time to share their stories so that others can learn from them. And at Mended Hearts, while we work a little bit in the primary prevention space, we work mostly in the secondary. So we're working with folks who have already had an event, or they're living with heart failure, or they're living with cardiomyopathies and things like that. And so we certainly, of course, in all of our education, support a healthy lifestyle and healthy nutrition habits and healthy exercise habits. But really for us, a lot of the work that we end up doing is in access. And whether that's, priorities that we're advocating for, or if it's in the programs we're developing, it's so that people in all communities and in underserved communities especially can get access to the medications that they need, and that they're affordable, so that they have access to not just a first opinion or a second opinion. I mean, there are so many communities out there where people aren't even seeing like a GP, let alone a cardiologist or a specialist in certain areas like cardiomyopathies, where you might need to be in a center of excellence, and people just don't have those options. And so a lot of what we advocate for are those acts and those bills that are going to increase access for people. And we've done it in a few different ways. We've been to the Hill a couple of times. We're going back again, Alina, as you know, in February. And we'll be working on policies there that help, increase that access, hopefully. And the last thing I'd like to add, what's important about what we do, and I think, Brianna, hearing your story, and Assemblyman Gray, yours, it's that story that's so important, because you really, until you hear what happened to someone and hear the impact that it had on them and their family members, it's hard to understand the impact until you hear it. So I'm grateful that they're on here and sharing their stories today.
Yes, thank you so much. And that's actually a great transition into the next question, where we know that racial and ethnic disparities play a really big role in health outcomes. So I'd like to ask what steps are being taken to address these racial and ethnic cardiovascular disease disparities and to increase access to healthcare, as Manny just talked a lot about, through legislation and nonprofit initiatives, and how can the community help? So why don't we go in the reverse order? If there's anything you'd like to add on to what you were just talking about, Mandy, about specifically racial and ethnic disparities?
Yeah, I think for us, we've been around it'll be our 74th birthday in February. So we've been around a really long time. And for a long time, our chapters and groups around the country have, they've existed in close to hospitals. They've existed in areas that probably have fairly good health care, the suburbs, in cities, and a few rural areas. But we really, over the last 5 years, have tried to make an effort to connect in all parts of the country so that we are there to provide services and education for everyone across the board. And so some of the programs we're doing to encourage that, we've got one program called Together for Heart Health, where we're going out and we're trying to make relationships, build relationships, and partner with organizations who may not be, they're not large enough to connect and make those connections or to have their own policy initiatives or to go to the Hill. But if we partner with them, then they can get the education, they can get the advocacy ideas to their people, and they do it because they're trusted already in that community. So we don't have the trust in various communities around the country. But if we build relationships with people who already do, they can then get the information to their members of that community. So that's the way we've tried to do this, and we're just going to continue to work at it. It's not easy work. Basically, you're just kind of cold calling nonprofits around the country and trying to make connections with them and build a relationship with them so that you can share what you have with them. So that's what we're doing at a grassroots level anyway.
Yes, thank you for that. And what are your thoughts, Rachel?
Yeah, so I think that this is a very important issue in the cardiovascular health space, and it's something that through a bunch of bills that the Assemblywoman has, I think is being addressed. These are bills that haven't passed yet, but ones we're hoping can pass. One that we're going to be introducing in the upcoming session would train 911 dispatchers to identify when someone's having a cardiac arrest, and then coach the person over the phone on how to do CPR until first responders arrive. And that's something where not everybody may be trained in CPR. So having someone to coach you over the phone is going to be really helpful and kind of expands that to everybody, getting rid of those disparities. And 11 other states have done this so far. So it'd be great to get this done in New York. Another bill, which is currently number A5038, it would prohibit smoking in private cars where there's a kid under 14. Secondhand smoke can lead to disease, premature death in children, and so many more adverse effects. So preventing that and preventing kids from being in that space, and all kids across all people would be very helpful for them. And then another bill I want to mention, the New York Health Act, which would expand healthcare coverage to all New Yorkers, meaning that more people have access to healthcare. And New York State already has great healthcare compared to a lot of other states, but expanding it to all New Yorkers under one big plan means more preventative care for people and better access that can help get rid of future problems. And then a lot of bills that are about placing AEDs in more places. The Assemblywoman doesn't have any of those bills, but there's a lot of other members who do. Some of these bills go through the Health Committee. So just wanted to mention those. But I think those are a lot of bills that will expand access to care for more people. And I think that's great about removing those lines.
Yeah, those bills definitely sound very impactful. And yeah, Brianna, what about you?
Yeah, so I think we all acknowledge that cardiovascular disease and cardiovascular deaths are higher among Asian, Black, and Hispanic individuals. So a lot of what we try to examine in our policy work is how do we address structural racism when we're crafting policy. And we've kind of identified some key areas of social drivers of health disparities in which we work in. So there's definitely a lens for access to healthcare, as a lot of my other panelists have mentioned. Connecting individuals to healthy and nutritious food is another barrier that we try to address. We also see, in that structural racism, there's access to healthcare needs, access to transit, access to education, and then just overall, access to a healthy environment. So there's, in our policy work, as we're crafting, what we're going to work on, we're always looking through it with that kind of lens of how do we address these underlying issues to better individuals' heart health. And so I think what we can do, is always considering equity when crafting policies, seeking information from those with lived experience to help better inform the work that we're doing, and also meeting individuals where they are and understanding cultural needs, I think will go a long way as we try to address this. And then as a community, I think some of the areas that we're working on in terms of health equity are truly, like I said, connecting people to healthy foods. So looking where we can, maybe put policies in place that will help individuals who might live in food deserts. Do they have a grocery store? Is there a way to increase their access to nutritious food? Another area when we talk about community response, and I know Rachel had mentioned this, is we are working on legislation that would train all our 911 dispatchers in CPR. So having, we know obviously that Black and Hispanic individuals have some of the lowest rates of bystander intervention. And we talk about Black and Hispanic women, their rates of intervention are even lower. So looking, how can we establish a nation of lifesavers and ensure that there is going to be a bystander response? So TCPR, having that line available when someone calls 911 to give those instructions over the phone and help that individual feel comfortable to act in an emergency is definitely a way. And then we're also working on something that cardiac emergency response planning in schools. So having a plan in place, so when a cardiac emergency does take place, that everyone knows kind of what their role is and that there's a quick response. This is another way that we can see, or that has proven to decrease some of those equity issues, because it's enabling our individuals in the community to act quickly and take action when there's a sudden cardiac arrest. Thank you.
Yes, I completely agree. And I would love to hear your thoughts on this too, Assemblymember Gray.
So first thing, and I think Brianna just talked about having access to healthy foods and stuff. I would say that most people have more access to smoke shops than they do healthy food options right now. And so I have legislation that's in the assembly right now that will actually create a situation where these smoke shops have to actually be licensed by New York State in order to open and operate. And it puts certain restrictions, much like the State Liquor Authority has on locations of bars and whatnot. So it puts restrictions on, they're locating the premises near addiction centers, near schools, near churches, a whole range of items. And we see all too often those smoke shops, they're getting closed down, and literally people open them back up in 72 hours. They have what I like to say in very simplistic terms, a pocket full of LLCs in their pocket, in their back pocket, and they shut down under one LLC and they open up a block away in another LLC. And I think if we go to, and there's many, has to have front street access. It has to have no barriers for visual inside. I think we have a community that just sees a smoke shop on every corner. And, that is one thing that we really have to, we have put forward legislation that will also put more responsibility on the schools to prevent vaping, and would also have a hotline for students to call in to either respond electronically or call in to New York State Ed if there's a persistent problem with vaping and they don't feel the school is being addressed. Basically a way of elevating it in the schools. So I really think we have to get our handle around that in terms of public policy. The other thing that I would say that you folks might want to get certainly very involved in is the 1115 waiver program, which is a social care network, and the 13 regions that were created around the state. And within each one of those regions, there's a provider, if you will, that's going to work with all the CBOs, community-based organizations, that are going to look at the health determinants. Essentially, the whole idea behind that is to make sure that people are healthier before they need the care. So, and it's really geared towards making sure we have a healthier population than a sick population. We actually treat health and not treat illness. So, I would just encourage you, if you're not, dialed into the social care network as a CBO, to try to get that.
Yeah, thank you so much for that. And Dr. Thomas, would you like to add anything?
I think what I'd like to do is just give a little bit of background on the American Heart Association and how it's pivoted in recent years to focus specifically on social determinants of health. And so if you go back 100 years, the American Heart Association just celebrated its 100th year at the end of June 2024. And for those that don't know, the American Heart Association for that last 100 years or so has been the largest non-governmental funder of cardiovascular research in the country. And for most of that 100 years, it focused almost exclusively on that research funding goal. But especially over the last 5 or 6 years, the American Heart Association really has become a leader both nationally and locally in addressing those social determinants of health and overall health, not just cardiovascular health, because it turns out a lot of the same things that impact brain health affect heart health. The same things that affect other organ systems also affect the heart. So by focusing on overall health, not just heart health, you really are helping the heart as well. And so, the main way the American Heart Association has done this is partnering with local organizations right in the community to solve or at least begin to try to solve longstanding problems that some of our neighbors have in getting regular health care. And several of the panelists have mentioned multiple times about difficulty with access to care. So one incredibly novel idea the American Heart Association came up with and funded was an idea of screening for high blood pressure in barbershops and in local libraries, right? Going to where people are, as opposed to the usual model, which is expecting people to come to a provider to get those services. So it's little things like that that can make a huge difference in addressing some of these monumental disparities in health outcomes amongst different races and genders. The American Heart Association also works with local food pantries. The concept of food deserts has come up a couple of times in this conversation. And not working just with them to get food, but also to encourage healthy food being provided. So, the American Heart Association wants to hear from local community organizations. We want to partner with them. We want to work with them to try to fix some of these disparities that the other panelists have talked about, and perhaps do it on, both by pushing for legislation, as was referred to by the assemblyman, but also through non-governmental means as well. So we want to hit all ends of the spectrum. Thank you.
Yep, thank you for that. And now let's talk about some of the gaps in youth public health. I think we were just talking about how a lot of the things that affect heart health can be applied to just health in general. So from your experience, what gaps remain in the current approach to addressing youth public health, and how can we fill those gaps? So why don't we start in the middle? Brianna, do you think there are specific barriers that prevent youth from accessing health resources or areas where more intervention could help?
I do. Quite honestly, a lot of times in my work, I find that as much as we try to be proactive, the policies that resonate are often reactionary. So when we talk about tobacco use among youth, we know that vaping is rampant. I I think there is a lot more proactive steps we can take, a lot more education that we can be offering to inform young individuals of how dangerous some of these habits are to their overall health, or what the long-term detriments are of these, of using tobacco. When we think about connecting individuals to healthy food, I wholeheartedly believe that we could be doing more to instill those healthy eating habits at a young age, so that individuals are carrying those habits through adulthood. And I think just giving the information and having more educational approaches in our schools, or in the community for young people, to keep them informed the best we can, will go a long way when we're talking about what we could do better in a youth health sense. I also think we have come a long way in teaching our young people like CPR in schools before they graduate, in building a nation of lifesavers. But I think we can be doing more to teach them and educate them about their overall health, and ways that they can proactively take care of their health, and not waiting till something goes wrong in their life, maybe later on down the line when they're in their 50s, 60s. It could be earlier on as well, for them to make those healthy decisions starting at a young age and carrying it with them through life, so that hopefully they don't have those health issues.
Yeah, I definitely agree with that proactive rather than reactive approach to health. And what about you, Rachel?
I feel everything that you're saying, Brianna, is something that I totally agree with. And just that idea of, in the legislature, everything is like, oh, this thing happened, we got to do this now. And there's only so much it feels like you can do proactively. And that's something I've seen time and time again. But that idea of education, teaching young kids, I think with smoking and vaping, there's already been so much that's been done, but until it's finally fixed and we don't have kids vaping at the level that they are, there's not much we can, we got to figure out what to do. I think more education about healthy eating, that's another big one. And then even education about how important keeping healthy is, whether that's going to the doctor, getting the care that you need, and then transferring those skills into adulthood. Maybe you're dragged to the doctor as a kid, but then you kind of forget about that as an adult and you don't go as often, and then those health problems start to come up. So I think starting those healthy habits young are something that's so important, and education surrounding that is what'll bring this forward and prevent us from having to do these retroactive changes that can only be a band-aid on a bigger problem. But I think that, we just got to keep taking steps and moving forward.
Yes, definitely. And what about you, Assembly Member Gray?
I think it comes down to physical activity and nutrition. And I think we need to make sure that we're getting more locally grown foods in our schools for healthier, for healthier nutrition. We have to do better at that in terms of getting healthy food in schools. And I think that the doctor just mentioned meeting people where they're at. How about meeting kids right at schools, and doing some education there, and all physical activity. I think too many kids are relying on video games, lethargic activities, that and eating incorrectly at the same time. So which are both divergent paths from everything that we are talking about or we are advocating for in this conversation. So I think I think it's incumbent upon us to make sure that starts sooner and starts in the schools as quickly as possible.
Yeah, and what about you, Mandy?
Yeah, unfortunately, we've seen even more people in their 20s and 30s and 40s, like more than ever over the last few years, come to us needing support. So and in developed countries around the world, we're seeing, some cardiovascular conditions decreasing in older folks, but increasing in people in their middle age and younger. So it's a huge issue, and sometimes it feels insurmountable. I'm dealing with this with my own household, trying to get my 20-year-old to stop vaping. And I've been talking about this growing up with a mom who smoked. I've been talking about the dangers of smoking and tobacco since they were born. And it doesn't matter. I can say it all. And the influence of their friends and media is sometimes overpowering. And maybe that's one of the places that we haven't harnessed yet enough is social media and finding the right people to be the right influencers. Maybe there's some hope in that arena where we've kind of failed with vaping, I think, especially. But I also agree that having access to healthy foods is so important. And there's just so many places that people of all ages don't have, it's so much easier for them to buy at the corner store potato chips or all the sugary drinks. You go into places in Europe and all of their little stores have fruits and vegetables and there's the little stores. And here that's so rare to find in a gas station or a quickie mart kind of thing. So yeah, I don't have a lot of good news. Sometimes it just feels impossible.
Yes, thank you for that. And Dr. Thomas, what about you? What are your thoughts?
So I guess I'll just pile on the bad news. But before I do, I just want to echo what Selma and Grace said. We got to get to people in the schools. So we don't teach basic life skills in schools anymore. We don't teach civics to any significant extent. We don't teach personal finance. We sure as heck don't teach nutrition. Nobody knows what a Mediterranean diet is. Perhaps if we have some time, we can go into what that is. But I'll summarize by saying it's the only diet ever shown to reduce the risk of heart attack, stroke, and death. So that's kind of important to teach people. We don't teach about fitness. Most kids and youth don't understand they're supposed to be active, physically active for a minimum of an hour a day. I guarantee when you're sitting around with your thumbs on your phone, that doesn't count as activity, right? The CDC released data just 3 months ago showing that now 3/4 of all Americans are overweight or obese. It's getting worse. It's not getting better. And half of those are clinically obese, not just overweight. And the seeds of this obesity pandemic or epidemic, excuse me, are really, sown in the younger generations, right? And so we have to have that focus on nutrition and exercise in school. And then just from a legislative standpoint, we know that unhealthy food is significantly cheaper than healthy food. And so there are strategies that can be pursued to change that dynamic. And so certainly in the community, things can be focused on, but certainly legislatively, we can come up with policies that entice and incentivize people to provide lower cost, healthier food options than the bag of chips and soda that you can get off of any gas station shelf. So I'll leave it at that.
All right, thank you so much. And so I had another question, but looking at the timing, I think let's move to the Q&A just so we can get some of those questions answered. So someone asked, what role do you think technology and digital health tools could play in public health for youth? I think Manny talked a little about social media, but yeah, anyone feel free to jump in.
I'll take that one. So generative AI is going to change medicine and health completely over the next 5 to 10 years. I asked ChatGPT earlier today how to make healthy food more affordable for the economically disadvantaged. And guess what? Within 3 seconds, it came up with 17 proven and validated methods to do so. And 16 of the 17 were legislative, whether it's expanding SNAP benefits, universal school meals, subsidized healthy foods that I was talking about earlier. And that's just at the beginning of the AI revolution. In 5 years, we have no idea how powerful this is going to be and what kind of answers it can potentially provide us. And again, yes, there's some junk in AI, don't get me wrong. But this, I checked every single source on what it spit out, and it was all clinically tested and proven, strategies that work. So I believe AI is going to completely revolutionize how we do things in medicine and how we can deliver preventative services to people.
Yeah, would anyone else like to add anything on that? All right. Then someone else asked on a more positive note, what are some of the most effective ways you've found to raise awareness and support and get people to take action? Anyone would like to jump in?
For us, I would say it's storytelling and that personal one-on-one connection. So many of our members are visitors. So after they've experienced a heart event, they'll go out and visit at the bedside to someone else who has had a heart event, or is a family member who maybe their family member just had a heart event. So it's that personal connection and really getting that feeling for what has happened, not just seeing it, but feeling it as well.
All right. And another person asked, what are some common misconceptions about cardiovascular health?
From people who have not experienced it, I would say their perception is they think it's, like an endpoint versus something that you can. I mean, a lot of people don't understand that, with the change of lifestyle, with change of, whether it's activities or just daily living, that, you can work your way through a lot of cardio. And I'll say that with a doctor on here, but a lot of it, as I was told out in, Strong Memorial, your heart is a muscle. You're young enough with the right lifestyle, you can turn your whole life around and live a very healthy, happy life. And a lot of people, I would say, that don't experience, they think it's like the end, versus no, it's just a process at this point. Just a process of living better.
I would say, to piggyback on that, two common misconceptions I've run into literally every day of my practice for decades. Number one is that people think they can wait, that they don't have to fix their cholesterol today, that they don't have to work on quitting smoking or fix the high blood pressure, change the diet, control the blood sugar today. There's always tomorrow. Well, guess what? Unfortunately, sometimes there's not. And yeah, heart disease is a continuum. But 1/3 of first heart attacks are fatal, as in you don't get a second chance. So I just emphasize over and over again, start now. I don't care if you're 20, 40, or 80, start today. Don't say, I'm going to start tomorrow. Start today. One other misconception I would bring up is that there's a lot of bad information out there on nutrition and diets. There's a lot. And I referenced the Mediterranean diet earlier. You can Google it, you can look it up. It's really easy to figure out. Again, that's the only diet that's ever been validated to save lives. Nothing else that's out there does. And so I would just ask people to be thoughtful in looking at this, and realize that just because an influencer says that taking 46 ounces of coconut oil a day made him or her much healthier, maybe not be the best source of information.
Thank you for that. Yeah, and on that topic of nutrition, someone asked, in our current food supply, it's very hard to stay away from highly processed foods, which furthers the obesity epidemic. So how can we work on decreasing the amount of chemicals in our food that's banned in other countries around the world?
That definitely sounds like a topic for the legislative branch.
I can jump in and say, I think there are definitely policy solutions when we look to other countries and how they tackle this. I would encourage, something I have just personally started doing is read the label. Read the food labels. It is important. Sometimes people don't understand how to read a food label. So I would say take those steps to understand, like, what are you putting into your body. It's something, I have two small kids. It's something I've started doing. look and see what is in the food you're eating. Is it dyes? Is it fresh food? And take some time and do some research to see what these, I don't know, chemicals, what's making up your food, what it could do to your health. I know there are some groceries in the stores in the US who do not put certain things in foods like preservatives. So I would say definitely education is one thing we can start with aside from legislation. Try to educate yourself as much as possible, and really read those labels.
Yes, I definitely agree. And I guess kind of the last question that I will just ask, the one that I had planned for before, to end this off, looking towards the future, in 3 words, what are the key trends or developments you believe will shape the landscape of cardiovascular health for youth in the coming 5 years? And I guess anyone want to jump in, or we could just go through everyone really quick in 3 words or more.
I already used my 3 words, generative artificial intelligence, so I'll leave it to others for their 3 words.
I would say increased access to care. That's increased access to care. I think that's about 3 words, and that would be hopefully the
I'll offer 3 words: educational paradigm shift.
And I'll jump in and say, whether it's right or wrong, I really do believe social media influencers, they have a big audience and they get messages across, whether, something we should look to harness when we talk about cardiovascular health.
I just have 2 words, and it's personalized medicine. There are a lot of advancements right now that for the positive that are going to make it easier to treat people individually.
All right. Well, I think that'll be all for today then. For the questions that we were unable to answer, you'll be receiving a thank you email tomorrow, so feel free to reach out if you're still interested. And we are ending a little earlier than predicted, but thank you to all of our panelists for your invaluable contributions and helpful information today. And thank you to everyone else for tuning in. We hope this conversation has provided all of you with some practical takeaways for advocating for better cardiovascular disease prevention and promoting healthier outcomes in your communities and your schools. And as we've heard today, the work is really far from over, but with collaboration, commitment, and action, we can all make a meaningful difference. So to learn more about Guardians of the Heart and our upcoming initiatives, please visit our website at www.guardiansoftheheart.net. And thank you again. We look forward to continuing this important work together. Have a great evening, everyone.